Hello and welcome to a brand new episode of Health360. On the show today, the ostensibly harmless and beautiful bird, the pigeon, could be causing you that lung ailment that you never suspected this so-called harmless bird of. That's the newest problem that city dwellers are dealing with. Also on the show, we're going to be telling you on how surrogacy is going to completely change in the age of artificial intelligence. Robotic humanoids are now doubling up as mothers. They will be carrying a baby in the artificial womb. Also telling you why it's absolutely important to follow Prime Minister Narendra Modi's advice of cutting oil by at least 10% from your meals. How to do it? Very difficult? Actually not. We'll tell you on how to go about that. That much more up ahead on the show. I'm Sneha Mordani. You're watching Health360. Well, they may look harmless, even charming, but what pigeons leave behind could be putting your lungs at risk. Invisible to the eye, deadly to the lungs. Pigeon droppings can release toxic spores into the air, leading to serious respiratory diseases. Our top story is going to give you an idea about all the hidden risks associated with pigeon droppings and how it is really affecting the air we breathe. These pigeons here, ostensibly harmless creatures, symbols of love, are now leading to war in cities and urban centers between city dwellers who love to feed these pigeons and healthcare experts who say that their droppings, pigeon poop, is a serious health concern, causing problems among city dwellers, and that this sort of feeding must stop. It causes hypersensitivity pneumonitis, also known as bird fancier's lung. This is an immune-mediated lung condition triggered by repeated inhalation of fine dust particles from dried droppings of feathers. But pigeon droppings also cause cryptococcal meningitis, which is a fungal infection that spreads from the lungs to the brain, with symptoms such as confusion or changes in behavior, and cysticercosis, which is a bacterial infection with pneumonia-like condition. But do people even know about these problems? Birds and animals usually capable होते हैं अपने लिए खाना ढूंढने के लिए. तो ये खाना जब आप देते हैं, आपको पता है कि एक्सेसिव खाना होता है, तो एक्सेसिव पिजन के ड्रॉपिंग्स भी होते हैं, उनके पूप होती है, जो जैसा उनका एक्सक्रीटा होता है, वो ड्राई हो जाता है. उससे जो डस्ट बनता है वो हमारे लंग्स के लिए बहुत हार्मफुल है. एक बहुत बड़ा पब्लिक कंसर्न है, पब्लिक हेल्थ कंसर्न है. आपको इस बारे में क्या पता है?
नॉलेज नहीं मैम,
इस बारे में आपको
इसकी नॉलेज नहीं है. तो ये तो गवर्नमेंट बंद कर रहे हैं ना मैम. अब ये तो 20 सड़क पे तो बैठे, ओपनली बैठे. अथॉरिटी चाहे नोडा अथॉरिटी के अंडर है सारा ही. अथॉरिटी चाहे बंद कराए इनको, जब बैठेंगे ना लोग डालेंगे.
जैसे आप हैं, आपने मुझसे कहा आपको पता नहीं है. आपको लगता है कि ऐसे कई सारे ऐसे लोग हैं जिनको पता नहीं
है? बहुत सारे लोग हैं, 10-20% ऐसे होंगे इनको पता होगा. तो जिनको अथॉरिटी को पता है, गवर्नमेंट इसके खिलाफ अवेयरनेस क्रिएट करे, बंद कर दे बिठाना इनको. अब ये बैठेंगे नहीं लोग तो फिर लोग डालेंगे नहीं.
तो आप कह रहे हो कि अगर अवेयरनेस क्रिएट हो तो फिर आप भी इसको ना करेंगे?
हेल्थ इशू है, सीरियस हेल्थ इशू है, तो फिर उसके लिए हम भी एक सुटेबल एक्शन लेंगे.
Do you think that pigeon feeding should be restricted or banned in a way so that an awareness campaigns also generated in a city like Delhi where pollution is already a big problem?
I do agree that it should be in a controlled manner.
While in Delhi, this really hasn't ruffled too many feathers, at least for the time being, but in the state of Maharashtra, this has become a huge bone of contention. Public clashes, the matter even reaching the court. Mumbai's iconic pigeon feeding stations, known as Kabutar Khana, have sparked a heated controversy following a Bombay High Court order on the 31st of July 2025 banning public pigeon feeding due to health hazards like respiratory illnesses from droppings and heritage site damage. The Jain community, for whom feeding pigeons is a sacred act of compassion, protested the closure, particularly at the historic Dadar Kabutar Khana. Their defiance, including removing BMC installed barricades, led to clashes with the police. Dr. Harish Shafle from Mumbai's Glen Eagles Hospital is now joining us. Thank you so much for your time. This is a problem which has become almost centric to Mumbai city. Yes, in Delhi and other cities as well, but right now, a lot of conversation around pigeons in Mumbai. Talk to us about what you are seeing in your patients presenting with problems that indicate that they've come into proximity with pigeons and pigeon droppings, and that possibly could be leading to problems, Dr. Harish?
Yeah. So yeah, as rightly said, the problem was there, and it is getting identified more and more. That is what I would like to tell. So the patients who suffer from this exposure to pigeon droppings and pigeon feathers, they usually have a history ongoing. Basically, since maybe 6 months or more, they keep on getting this dry cough, and initially there is just cough, and then the cough is followed by breathing difficulty.
Right.
Usually, what happens initially, they don't. They adhere to a specialist to seek advice regarding it. They think that it's a viral infection and causing cough because the season is ongoing of dry cough, runny nose, and fever in everywhere. And so I think that is why this thing doesn't get detected early. So predominantly dry cough, breathing difficulty, and other symptoms associated is what I would like to tell.
Who's vulnerable in that sense? And I'd like to ask you, because I don't think everybody has come in contact with pigeon droppings would be vulnerable, isn't it?
Yeah, so most vulnerable basically usually will be people who directly handle the pigeons, or they try to clean the pigeon waste basically, which keeps on getting accumulated to their window panes and their important areas of their house. They try to they say brush or dust that area basically. Then there is an exposure of these white droppings, and once you try to show away the pigeons, they fly, and in the bargain they create a dusty environment of the pigeons also. So these are the persons who are at most risk, and also people usually elderly or people who are already on other medications who have other comorbidities. I would say if you get in touch with these pigeons every now and then it becomes you become more vulnerable.
Well, these pigeons play important role as environmental cleaners. These are natural scavengers. They pick up, clean up food scrap, even organic waste, and that's how they feed themselves. By feeding them, we're disrupting this natural cycle. It's leading to over-dependency. It can lead to overpopulation of pigeons, as we have seen clearly, and then related health problems, health risks. What experts advise is that this is their natural ecosystem. It would be best not to feed them and not disturb this natural system.
You are not supposed to directly touch the pigeon droppings, which is white in color basically, or pigeon feathers which come near you. So don't touch with your bare hand. That is the first thing I would like to tell. If you really want to clean that area for the droppings, whatever has been created, then use a gloves basically, or you might use a mask, an N95 mask with properly fitting nose clip is what I would say. But if you want to really get away with don't want to get exposed to it, then definitely don't do these things, or put nets around your home where there are spike nets also available where the pigeons will not come and sit in that area, or there are nets available where even if the pigeon comes and they fly away, the feather droppings will not enter your room. So all these precautions are very important, particularly not to touch the white of the pigeons, and wearing mask whenever you are handling these pigeons.
Well, for most people, pigeons may not be causing problems. But for those people who are having problems like chronic cough, or for example, some sort of respiratory distress, you are in close proximity with pigeons, it would actually be a good idea to get in touch with your doctor and figure out if you're suffering from any problems that are being caused by pigeons. What if the next chapter of human birth didn't even begin in a woman's womb? Meet the world's first pregnant robot, engineered to stimulate, carry, and even deliver life. Science fiction? Not anymore. This is real research, real robotics, and a real ethical dilemma. As the line between machine and mother blurs, are we witnessing a breakthrough or a boundary really crossed? Let's tell you all about humanoids, the pregnant robot. Imagine a couple dealing with infertility choose to seek help and are told surrogacy is an option. The mother would be a robot. You heard that right. This is not a plot from a sci-fi movie or something I'm just cooking up. It actually could be a reality in days and weeks to come. Chinese scientists are developing the world's first pregnancy robot, a humanoid that will carry a baby in an artificial womb and mimic a full-time pregnancy. For those struggling to conceive, hiring a humanoid to carry their baby will cost about 12 lakh rupees or a lakh yuan. The machine, equipped with a system that feeds the fetus nutrients through a hose, could one day mimic a full-term pregnancy before giving birth. An AI robot, a surrogate, wouldn't conceive in the true human sense. Instead, it would house an artificial womb implanted inside its body where a fertilized embryo is placed. The robot's advanced systems would then provide nutrients, oxygen, and monitor the developing fetus, mimicking the functions of a natural pregnancy. AI has been a friend, companion to many. Now it could be taking on the role of a mother. The prototype will make its debut next year. But while the science is fascinating, it has opened a Pandora's box of legal and ethical debates. Yes, it offers hope in infertility, but what about the moral boundaries of creating life through machines? Love the flavor, but not the fat. You're not alone. From everyday curries to crispy snacks, oil sneaks into more of our meals than we actually realize. But small changes in the kitchen can lead to big wins for your health. In our next report, smart, simple ways to cut their oil, keep the taste, and feel the difference. Oil adds flavor, but it's also a hidden source of extra calories. Experts say cutting just 10% of the oil you use every single day can help trim your intake without feeling deprived. This is actually the Prime Minister's message as well, and he has spoken about it repeatedly.
अपने खान पान में छोटे छोटे बदलाव करके हम हमारे फ्यूचर को स्ट्रॉन्गर, फिटर और डिसीज फ्री बना सकते हैं। खाने में तेल का कम उपयोग और ओबेसिटी से निपटना यह केवल पर्सनल चॉइस नहीं है, बल्कि परिवार के प्रति हमारी जिम्मेदारी भी है।
हमारे देश के हर परिवार को चिंता करनी चाहिए। मोटापा हमारे देश के लिए बहुत बड़ा संकट बनता जा रहा है। हर तीसरे व्यक्ति में एक व्यक्ति मोटापे का शिकार होगा। हमें मोटापे से बचना है, ओबेसिटी से बचना है। कि परिवार तय करे कि जब खाने का तेल घर में आएगा 10% कम ही आएगा और 10% कम ही उपयोग करेंगे और हम ओबेसिटी के खिलाफ लड़ाई को जीतने की दिशा में हम अपना योगदान देंगे।
And Luke Coutinho, integrative lifestyle expert, is with us. Luke, thank you for your time. I want to begin by asking you, and we've spoken about this in the past, the Prime Minister has repeatedly spoken about the need to cut down oil. You know, why is it so important to reiterate this message again and again? The Prime Minister seems to be stressing a lot on this, isn't it?
Absolutely. When we met briefly for the second time, the Prime Minister kept saying that, Luke, we need to correct this problem at a prevention level. We're already the diabetic capital of the world. Now we have cardiovascular issues and following lifestyle diseases. He has specifically spoken about oil. because the consumption of oil within homes and even in outside food, roadside food, and restaurant food is way beyond the normal allowance of oil that we should be having. A lot of people think that oil just makes you fat, but we have to understand that obesity and fat is linked with diabetes. And that is why this point is so crucial, that we bring awareness into the homes of people, into everyone's lifestyle, that we need to reduce our consumption of oil through packaged
Yes.
food, ultra processed, and our own home food.
So there are small things that we can do to make a difference. Use a spray bottle or brush to lightly coat pans instead of pouring oil straight from the bottle. This controls how much you use and avoids overdoing it. Try steaming, roasting or grilling your veggies instead of frying. These methods need less or no oil but still taste great. The normal thinking of people in India, and I've seen that in my own home as well, is that agar oil nahi padega to khana tasty nahi banta. You know, the entire concept of steaming the food is really not there or non-existent in most households. You know, bust this myth for us, Luke.
Yeah, absolutely. Steamed food doesn't have to be boring
Yes.
or not tasty at all, because, like our Honorable Prime Minister said, he's spoken about a reduction of oil, not completely
Yes.
stopping it. So, even if I'm making a steamed vegetarian dish at home, I will drizzle a little bit of oil or a little bit of ghee so I can retain flavor and taste. But it's a reduction, and that reduction every day multiplied by 7 days in a week is massive for all of us. So we're not trying to stop it, but a steamed dish today, it's so beautiful. You can make a masala khichdi with a lot of veggies without using actually any oil, but you want to just drizzle a little bit of ghee on for taste.
True.
That's absolutely fine. The point is the overconsumption. And even if we want to have all our home meals with a little bit of oil, the problem is what we're eating outside. One meal outside will add probably 3 meals of the total oil that we're having. So it's actually the overconsumption that's causing the problem.
Swap creamy dressings with less oil, or better, use lemon juice or herbs to boost flavor without fat. Talk to us a little about how herbs can be used to add just so much more flavors to our food.
Absolutely. We're blessed to be citizens of our country, where we have so much tradition in the value of herbs. Just by adding a little bit of parsley, a little bit of coriander, a little bit of onion, garlic, we have spices in our own country. You can just add so much of flavor. And that's what the West loves about our food. They love the flavor. And we aren't using that kind of flavor. We're just depending on deep fried and fried, because, of course, deep fried and fried tastes good. But when we start adding flavors and herbs that we have locally growing across the country, it can just enhance the level of food to a different level.
Limiting fried foods will also make a huge difference. You mentioned fried foods, and I think the consumption of it is normalized. You know, everybody just reaches out for that samosa in the evenings with your chai. That is something that we need to fix, isn't it? This habit of having
Absolutely.
deep fried food.
I love a great samosa, and everyone should have a
Yes.
samosa once in a way. But the point is, the quality of oil being used is also questionable. You know, in some places, in some restaurants, and most of our fast food restaurants across the country, the quality of oil is directly linked with carcinogens, obesity, cancer, and heart attack. So now the quality of oil has changed. If you have a samosa once in a way with your chai, but people have made it a habit. They have it every day. So like I said, again, a samosa is not going to cause us to get obese. It's not going to cause our cancer. It's not going to cause our heart attack. But having it every day, and then more outside food, and not working out, and being a sleep deprived nation, all of this is just too much of burden of inflammation on our bodies. And so our Honorable Prime Minister also spoke about sleep. He spoke about the importance of sleep, because we may cut out oil, but we also have other lifestyle factors like being sedentary, being sleep deprived, the amount of screen time that we're using. So all of these contribute towards a larger disease.
Saute food with broth or water. Skimming off fat in broths will go a long way in reducing oil in foods we consume. On the 14th of August 2025, the Goa government unveiled a landmark initiative, a first for India, to slash costs of high-priced therapies for cancer, rare diseases and autoimmune conditions. In a bold move, the state authorities will negotiate directly with pharmaceutical companies to lower drug and equipment prices, bringing critical treatments within reach for thousands of Goans. Offered is fair and sustainable pricing. This pioneering policy is being hailed as the beacon of hope in healthcare affordability.
A landmark initiative is poised to transform access to high-cost medical therapies in the state of Goa. It has become the first in India to launch a value-based pricing policy for expensive treatments, particularly for cancer and rare diseases. Under the initiative, the state government will procure high-cost drugs, medical equipment, and diagnostics at negotiated prices below the listed market rates. The first rollout begins with therapies for lung cancer, where annual treatment costs can exceed 50 lakh rupees. The policy allows Goa's government to negotiate confidential, discounted rates on drugs, diagnostics, and medical equipment, offering life-saving therapies at far lower than retail prices. The rollout begins with lung cancer treatments, some of which can cost more than 50 lakh per year. Goa sees over 1,500 new cancer cases reported in the state every year, and numbers rising by nearly 5% annually. Breast cancer accounts for more than 300 cases annually, making it the most common in the state. Oral cavity cancers follow closely, making up around a quarter of all new cases. This drive is aimed at reducing the financial burden on families and improving health equity across the state.
Joining us right now is the man behind this big and important initiative. That's Goa's Health Minister, Vishwajith Rane. Thank you so much for your time. Talk to us, Vishwajith Rane, about the role of the state, really, of your government in negotiating with pharmaceutical companies to discuss the pricing policy and making medicines for serious ailments available to everyone. You know, what's the arrangement really been like?
Sneha, thank you for having me on your show, on your news. And basically, we have been trying, and we call our model, and we are very proud to say that under the visionary leadership of the Honorable Prime Minister, Goa has actually come up with its own Goa model. And a part of it is to make healthcare accessible has been the priority of the state government. And also when we see, and also you must have seen several shows on television where people talk about expensive drugs, life-saving drugs, and several drugs that are beyond the accessibility through any scheme to the common man. So the state government, if you have the NSG pool and you have the pool from where you get the rate or you get the rate for the medicines, what we thought is have the PPILT, which is basically it's a pricing policy and a confidentiality pricing policy for the state of Goa, where you have this type of pricing where you deal with all these companies in independent verticals so that we can get the best price for the final end user, that's the patient. So this is how we decided to move forward with this. Globally, it is an accepted policy, but Goa is the first state in the country to implement it.
You know, talk to us in comparison on how cheap these drugs would be as compared to, if you go and buy this in any other part of the country and from a regular chain. In comparison, how cheap would these medicines be, in Goa? Like, in a sense, give us the comparative figures here.
With confidentiality pricing, suppose you're buying a product even on a tender basis in your hospital, here through confidentiality pricing, we find after discussing with several pharmaceutical companies and associations of pharmaceutical manufacturers, this will be more than between 60 and 75% will be the cost reduction in procurement of these drugs. Once we get this price from these independent companies, the price will be a confidentiality pricing policy. So basically, we are in a position to negotiate and assign an MOU with the independent company that is giving us the best price. And only the government will know what is the best price being offered through this confidentiality pricing to the state, and so that we can push this product and give access to the patient and the poor people and the underprivileged and even the privileged people to actually take complex treatment protocols and make access to these medicines that otherwise would have been out of access of people.
Also tell us, why do you think this move was really the need of the hour in your state? Also, do you think it's time for other states also to follow suit?
Yeah, I feel that, time has come with healthcare and the type of complex disease and ailments we come across in today's time. Right. And also treatment protocols. Goa is also one of the only states in the country that is giving free medication and providing free healthcare. 100% free healthcare and high life-saving medicines and treatment protocol, whether it's chemotherapy or complex treatment for cancer, we are giving it free. So if we want to make and reach out to more amount of people, because the Honorable Prime Minister always says, and Modi ji's vision is that healthcare and give access to the last mile to the poorest of poorest segment of strata of society, and people who need this type of treatment protocol, you have to increase the umbrella that you're operating under, and have this thing and move forward. I thought confidentiality pricing will help us in cost reduction and make this treatment protocol and these medicines available to the common man and the middle class and the people who need these treatment protocols.
All right. I'm going to thank you, Vishwajith Rane, for joining in, sharing your views with that an important decision that you've taken for the people of your state.
Thank you, Sneha. Thank you so much for having me on the show.
Well, that brings us to the end of this edition of Health 360. We hope you enjoyed watching the show as much as we did putting it together for you. Find these reports and much more up on our website, that's indiatoday.in. All of India Today's social media platforms carry these reports. It's Instagram, Twitter, which is X, YouTube, and Facebook. Our hashtag is Health360, Health360 Plus. Do not forget to like, subscribe, and share. Thank you for watching. Bye for now.